we are looking at training law enforcers, and because we know that when a GBV issue arises in the community, it is the law enforcers that are supposed to take up that case. But are they trained to effectively provide support in terms of reporting? We have had cases where the law enforcers have even asked the girls, how are you dressed? Ulikuwa wapi? Ulikuwa na nani? We are also sensitizing, of course, our county health management team. At the end of the day, they are the policy makers. They're the ones that ensure that we are putting in place policies that are progressive and are supporting GBV cases. And so they will be our change agents at the policy making level under the leadership of the of Waziri. We are adding 3 more lawyers in this county that will be available to effectively, efficiently, timely provide pro bono legal support. What that means is they will go to court on behalf of the young people or the women that have been violated, and they will provide this support for free, and RHK will take care of the cost. Been able to to map out safe houses, because again, I have been perpetrated and you're leaving me with the perpetrator. Are you really helping me? No. So through the county government, we have mapped out safe houses, and when we have a victim of gender-based violence and who doesn't want to go back home, then we have clearly mapped out those safe houses, and we will take them there as we take care of them. So you can see we have a whole ecosystem that is supporting the victims of gender-based violence, and RHK will be here for 2 years for particularly that project. And that project has been funded by the French government through the International Planned Parenthood Federation, the Africa office, and RHK is coming in as an implementer together with Kakamega County. And we are implementing both in Kakamega County and Nairobi County.
The US government, through USAID, was supporting counties majorly to deal with matters HIV, AIDS, gender-based violence, and many, many other areas related to health matters. Now, this has left counties with a lot of financial stress, because it is now upon the Kenyan government to ensure that whatever the US government was doing, we are able to do it ourselves. Kakamega County, we were receiving almost to a tune of 400 million support in a year just to deal with matters HIV, TB, malaria, and many other areas like gender-based violence, which we are discussing today. So you can imagine the state into which we are in, given the scarce resources that we keep experiencing in this country. So this, therefore, gives me a lot of happiness that Reproductive Health Network Kenya has come on board through the through the French government, and we really want to appreciate the French government for offering this support to the Kenyan government through Reproductive Health Network. This is going to reduce the financial deficit that we would have had in terms of handling matters to do with reproductive health. So we are very happy and delighted today to have the Reproductive Health Network Kenya, which is now coming in to see that we actualize this policy and this legal framework on issues to do with gender-based violence.
We are here with TSC and Ministry of Education, and we are saying the teachers have to change their attitude. If it is our county that will continue lagging behind, then the poverty indicators continue going. Ministry of Health alone, they belong to the Ministry of Education, they belong to the teachers. They for the longest overhaul. Beyond the 2 years, we continue to be in this county to serve and ensure that our community is
provide reporting and referral mechanisms on gender-based violence. We realize
this particular MoU is going to be very, very
providers and healthcare products in training and sensitization workshop. So actually, we and provide quality reproductive health. Thank you from the Office of the County.
Yeah, like that, yes.